Diabetes affects almost 30 million people in the United States, with type 2 diabetes affecting 90–95% of the total, a genuinely worrying ratio. A high blood sugar level can gradually cause mild signs such as frequent urination and extreme thirst, which are important indicators of type 2 diabetes but may not initially seem severe. Until they learn they have type 2 diabetes, many people are unaware that they have high blood sugar. Diabetes raises blood sugar levels, and if you ignore the early warning symptoms, you may eventually develop serious health issues. Diabetes, even with a slight increase in blood sugar, can damage your heart, brain, nerves, kidneys, and eyes if you don't get treated. In this video, we'll look at 7 important nighttime indications of diabetes that you shouldn't ignore. Number 7. Excessive thirst. When there is too much sugar in your system, your kidneys work overtime to filter it out. If your blood sugar levels are regularly high, it can put strain on your kidneys, causing the excess sugar to be excreted through your urine. This process can leave you feeling thirsty and dehydrated throughout the day. If you continue to feel unusually thirsty despite drinking plenty of water, consider reducing your sugar intake or consulting with a diabetic specialist. Number 6. Vision issues. Diabetes can damage blood vessels, increasing your risk of eye problems such as impaired vision, cataracts, and glaucoma. If you notice changes in your vision, visit a diabetes specialist right away to reduce your risk of vision loss or blindness. Early detection and treatment of diabetes can help regulate blood sugar levels and perhaps improve vision. Number 5. Feeling numbness and tingling. A pins and needles sensation in your feet, toes, hands, and fingers can be an indicator of diabetes. Diabetic neuropathy is a form of nerve injury caused by consistently high blood sugar levels. It is commonly associated with tingling and numbness in the extremities. Diabetic neuropathy can develop severely if not treated properly, and in extreme situations, amputation may be required. Number 4. Craving certain foods. There are various reasons why having diabetes could make you crave food, especially sweets. You may turn to comfort foods if you are experiencing hormonal imbalances, which can cause melancholy and mood fluctuations. Your appetite hormones may be disturbed by these abnormalities, which may cause cravings for junk food. Moreover, insulin resistance, a typical feature of diabetes, may make you crave sugary meals and carbohydrates, which will quickly spike your blood sugar levels. Number 3. Mood swings. Like estrogen, testosterone, and the hunger-regulating hormones, leptin and ghrelin, insulin functions similarly in your body. Your hormone levels may fluctuate as a result of improper insulin production or utilization, which can cause mood swings, irritability, and sadness. Your mood can be stabilized by switching to a healthy diet, lowering your blood sugar, and receiving appropriate diabetes care. Number 2. Slower wound healing. Cuts, scrapes, and other injuries may take longer to heal if you have diabetes. Your immune system may be weakened by high blood sugar, which will hinder your body's natural healing processes. Furthermore, high blood pressure is a common condition among diabetics, which can narrow blood vessels and decrease blood circulation, which further delays the healing of wounds. In addition to lengthening recovery times, this longer healing time raises the possibility of infection, underscoring the significance of controlling blood sugar levels and closely monitoring wounds. Number 1. Enhanced urinary need. Diabetes is characterized by excessive thirst and frequent urination as the body tries to eliminate extra sugar from the bloodstream through urine. This procedure may cause you to need to use the restroom frequently, both during the day and at night, which may interfere with your sleep and signal insulin resistance problems. This discomfort is more than just an annoyance. It can cause dehydration and negatively impact your general well-being. If you are a diabetic and want to know which vegetable is harmful for you, then do not worry. Our complete video is on this topic. Watch this video to avoid this vegetable. Strategies for the management and treatment of diabetes. Since diabetes differs greatly from person to person, managing the condition requires a comprehensive and individualized approach. The management team is comprised of number 5. Blood sugar monitoring. Regular blood sugar monitoring is essential for managing diabetes. This may include using a continuous glucose monitor, CGM, or a glucose meter for regular tests. You and your doctor will evaluate what the appropriate blood sugar range is for you. Number 4. Oral diabetic medications. These are especially important for people with type 2 diabetes or prediabetes, as well as for those who still make some insulin. One of the most popular oral drugs is metformin. Oral medicine is another option for managing gestational diabetes. Number 3. Insulin therapy. Insulin therapy, which involves injecting synthetic insulin to manage the condition, is essential for people with type 1 diabetes and occasionally required for those with type 2 diabetes. Syringes, pumps, pens, or fast-acting inhaled forms can all be used to administer insulin. Number 2. Dietary management. A healthy diet has a big impact on blood sugar levels. Carb counting is essential for figuring out insulin dosage for people using it. In addition to helping with weight management, a balanced diet lowers the risk of heart disease. Number 1. Frequent exercise. As exercise increases insulin sensitivity, it is essential for all individuals with diabetes to control their condition. How can you reduce the risk of diabetes? While there may be no cure for autoimmune and hereditary forms of diabetes, there are methods that can lower the risk of prediabetes, type 2 diabetes, and gestational diabetes. Important tactics include maintaining a healthy weight, managing stress, limiting alcohol consumption, making sure you get 7 to 9 hours of sleep each night, giving up smoking, eating a balanced diet, such as the Mediterranean diet, exercising for at least 30 minutes most days, and adhering to your doctor's recommendations regarding heart disease risk factor medication. Certain risk variables, such as race, age, and heredity, cannot be altered. It's crucial to keep in mind that there are several contributing factors to type 2 diabetes, making prevention difficult. We explore important diabetes symptoms that should not be disregarded in our in-depth guide, 7 Diabetes Nighttime Signs. You shouldn't ignore, including extreme thirst, blurred vision, numbness, food cravings, mood changes, delayed wound healing, and an increased urge to urinate. These symptoms highlight how crucial it is to manage diabetes with a balanced diet, frequent exercise, medicine, insulin therapy, and blood sugar monitoring. We also go over ways to lower your chance of getting diabetes, with a focus on lifestyle modifications including eating good food, managing your stress, and keeping a healthy weight. If you have diabetes and are unsure about which bread varieties are good for you to eat or avoid, this in-depth video provides all the information you need. Click on the description's link. Remember to share this video, subscribe to our channel, and leave a comment